So I'll start off my day with my review cards, just the cards I've already seen, already gone through, and I'll finish all of those. That's typically 200 to 400 cards. Then it's time for me to learn my new content for the day. I'll read through the lecture slides, watch videos on Boards and Beyond for like my major like content or whatever, Pathoma for all like my pathology stuff, and like Sketchy for all my pharmacology stuff. First aid is like the major like med school textbook that you have to use to study for like step 1. The goal is to like basically go through USMLE-RX and my Anki cards and learn everything I can from there. I won't go through all of those resources every day, but I'll have something that I'm reading for to like basically, okay, this is my first pass, is me just trying to deeply understand the topic. Okay, once I understand it, I do my Anki cards and then I finish however much Anki that is. I typically try to do at least like 200 or however many topics for that week. I'll try to just put in however many cards that corresponds to every day. And then I'm just like honestly, most of my days is literally just doing starting my day with my review Anki, doing like 4 hours of like learning new content, and then the rest of my day is just doing my new Anki cards, just rinse and repeat. And then once I know enough, because you can't jump into questions for stuff immediately for a lot of these things, because a lot of the questions aren't just like basic, okay, do you know what this thing is? They're asking, okay, I like to say that you have to answer 3 yeses before you can truly like answer the question. You have to say, okay, they'll give you a clinical vignette, which is basically just like the question stimulus that talks about like 50-year-old man walks in with chest pain, shortness of breath, family history, blah, 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 and all that stuff, their medication they're taking. And people will often ask like, okay, what medication, or what is this, so they are taking a medication and the medication is giving them a side effect. And so they'll ask you, okay, what is the medication that they're taking for this disease? And they won't tell you the disease. So I feel like it's really cool. It's like, okay, not only do you have to know what the disease this is, how you would treat this disease, and then they'll be like, okay, what is the major side effect of whether you're using this specific mechanism to then treat this disease. And I feel like that one's like, those are like the questions I love the most, when they're super deep. It's not just like, okay, can you recognize these symptoms? Because honestly, it's not that hard to make a diagnosis for a lot of the things. It's like, okay, it's all just pattern recognition. All of medicine is just pattern recognition, at least like for where I am right now. Like that's why repetition works so well, because like, okay, you see the patterns over and over and over again until the point where it's like, I understand it now. Once it starts to get closer to like a testing period, then that's when I'll switch over to practice questions and just try to crank out as many practice questions as I can in order to fully like understand, okay, now I have the basis of knowledge, I have my toolkit. Now I have to see how the questions can be asked for me to understand. Just because I fully understand this disease, knowing how it can present in different questions is very helpful, especially as like, okay, if I've seen this present in this many ways, or the questions can be only asked in so many ways. Once I get to the test, I've seen a question like this before, I can think my way through it, boom. So that's what my week looks like actually in school. Most of my days, like 5 days a week, from 8 to 7.